Yes.
Okay. Okay. I'm going to share my screen. Now, one of the things that we're talking about today is the importance of fourth dimensional thinking when it comes to considering sex and gender. And so we're actually going to take some time here in class to watch a video together. Now, it probably is not going to come through on your screen very well. So what I'd like you to do is to go under Files, click on Discussion Ideas First Week under Discussion Notes, and go to these videos, particularly the second video here, okay? Because what we're going to talk about here for a few minutes is that when it comes to biological sex, there are more than one, more than two even, more than three even biological sexes. And not only that, but determining sex can be very challenging and quite controversial because some bodies are what are called intersexed bodies. So many people born intersex are assigned a sex at birth, and that one may or may not fit with their gender identity later. And so let's go ahead and watch this movie by this little documentary or interview with Eden Atwood, and then we'll talk more about what a remarkable person she is. So this probably won't come through on MS Teams very well. So if it doesn't, go ahead and pause this video here, and then you'll need to fast forward through this. Okay. Now, why in the world are we talking about Miss Eden Atwood? Miss Eden Atwood, her chromosomes are XY. And some of you who are in the habit of engaging in second dimensional thinking are going, wait, so does that mean she's a guy? No, it doesn't mean she's a guy. Wait, does that mean she's a woman? She identifies as a woman, right? Please practice thinking fourth dimensionally. So Miss Eden Atwood has a condition called androgen insensitivity syndrome. Okay, that is a syndrome where the cells of the body do not detect and do not respond to male hormones called androgens. So therefore, somebody with XY chromosomes will develop along feminine lines, what our culture identifies as more feminine. All of us, as you know, are female in the womb until male fetuses start to produce androgens, and it develops them in a male direction, whereas biological women continue to develop without interruption because the androgen disrupts and changes a particular course of development in some ways. So I became more acutely aware of androgen insensitivity syndrome some 15 years ago. One of my doctoral students was in a lot of trouble. When you're finishing your doctorate degree in counseling or clinical psychology, you are required, in order to license, to have a 1-year clinical internship or residency. So even though you've done lots and lots of clinical work as a doctoral student, doing assessments, individual therapy, group therapy, etc., you need to work for a full-time year as a psychologist under close supervision. And if you screw that up, your career is pretty much over, right? Your clinical residency, your clinical internship, depending on where you are, they call them different things. And if you mess that up, it's really hard to get another one because other places will assume you're not competent, capable, or you're engaging in unethical practice. And so when my student Ginger came in, she was distraught and crying, and she was under a DNC that she could not talk about why she was in trouble, only that she was. And she asked if the HR department at the hospital where she was working as a psychological resident could contact me about a case. And so sure enough, later that week, the HR department contacts me and says, okay, Dr. Draper, You're the only one in the region who is qualified to assess this particular. We're not going to disclose to you because we don't want to bias your assessment, but we'd like you to come in as soon as possible. And so I cleared up some space on my calendar and drove out to that hospital. And when I drove out to that particular hospital, the patients in question were meeting with me, and quite to my surprise, it wasn't one patient, but two. There was Latina woman, age 22, Caucasian male, 24. He's tall, looks like a Midwestern farm boy, tall, blonde, blue-eyed, tanned, used to hard work. She's very stunningly attractive, very curvaceous Latina girl, Latino woman, excuse me. And that's the way she identifies. And as we begin to talk, I learned their history. She was born and raised to a somewhat poor family. We would consider them lower class, but in Mexico, they were considered lower middle to middle class. And she and her sisters from a young age were acknowledged as beauties, like beautiful young ladies in their particular community. And so she got modeling gigs starting from the time she was about 11, and that continued into her 20s. And she began to develop secondary sexual characteristics, broad hips, large breasts, narrow waist, etc., pretty early on. She was about 13. So by 15, she was modeling in swimsuits, so she was a swimsuit model. Well, her future husband, they actually met on a shoot because he is very, very good at taking both static and dynamic portraiture. So he's a very effective photographer for modeling agencies. And he's just a poor old country boy who got sucked into this glamorous life of photography. And part of the reasons why is he works very hard. He's very diligent, extremely kind and respectful. Well, excuse me, they took a shine on each other, really started crushing each other on a photo shoot in the beaches around Cancun. Well, she's, modeling bikinis and he's being a gentleman, and so they had a whirlwind romance. She was raised very conservatively Catholic. He was raised very conservatively Catholic. And so whirlwind romance over 6 months and they get married. Well, they had saved themselves for the wedding night. And on the wedding night, they were both anxious. They were both really horny for each other. They'd done everything they could to follow the rules of their religion. And intercourse that night was extremely painful. There was a lot of blood. There was a lot of pain for both of them. They tried a couple of times. They couldn't make it work. They gave up. They didn't know who to talk to because she was raised in a family where sex is a taboo subject, and he was raised in a family where sex was a taboo subject. So neither of them knew what the heck to do. So they tried off and on for 3 months to have intercourse, and he thought it was something wrong with him, and she thought it was something wrong with her. But intercourse always involved blood and pain for both of them on any attempt at penetration. And so out of desperation, his cousin intervened and brought them to the OBGYN in the hospital. The OBGYN put her up in the stirrups, started to examine her, and within a few minutes stopped and said, "Wait here." Now she's still in the stirrups. The OB goes and gets a phlebotomist and they draw blood and they're gone, and then they leave and they're gone for about an hour. And when the OBGYN comes back, he says, "Okay, wait here." She's still in the stirrups, like her legs are numb, right? He just left her in the stirrups. It's been about an hour and a half. And so both these young couple, they're just terrified out of their minds. And so the OBGYN comes back, has her get dressed, and then tells her that the psychiatrist will be along directly to meet with them. And so sure enough, about an hour later, so at this point, they've probably been in the hospital about 3 hours. Nobody has told them anything. The psychiatrist sits down with them and informs them that she is chromosomally male, that her chromosomes are XY, and his chromosomes are XY. The psychiatrist informs them that this then is a gay marriage, that because they're both chromosomally male, that they are both therefore male, sexually male, and therefore this is a gay marriage. And back then, gay marriage was not legal in Indiana, so therefore the marriage would have to be annulled. So they are in shock and they're in desperation. And so she starts sobbing. The husband starts sobbing and embracing her and trying to comfort her. And so the psychiatrist diagnoses her with gender dysphoria. meaning that because she was very upset and she denied and denied and said, no, I'm not a man, I'm a woman. He said, you need to get in touch with reality, you're a woman, okay? So a lot of grief and a lot of trauma, and then the psychiatrist assigned her to work with the intern, my student, Ginger. So that's how Ginger came into the subject. And so Ginger starts meeting with this particular couple. And by the way, she met with them as a couple, which I thought was very wise. And early on, overwrites the psychiatrist's diagnosis without consulting him, that this is not just gender dysphoria or gender identity disorder, which is actually what the psychiatrist had placed in the chart, but rather grief and loss, right? She is grieving the fact that a lot of what she wanted in her life, to marry, she can, to have children, that's now off the table. In fact, later they went in for more procedures and found that where her ovaries should be, she actually has underdeveloped testes. She has no fallopian tube, she has no uterus. Her vaginal canal was very short and very narrow, hence the pain during intercourse. And so Ginger approached the couple in terms of couples counseling, and he was fiercely, the husband was fiercely on his wife's side. He wasn't going anywhere. He wasn't going to budge about this. He was fiercely on her side. And so he became the best advocate for her. And even though he was a shy, quiet country boy, he ended up being a fierce advocate for her behalf, a fierce advocate for her well-being. Remarkable. And so when I assessed this particular couple, here's one of the many problems with my field is gender dysphoria and gendered identity disorder both entail a difference in one's feeling about one's gender in opposition to one's biological sex. So she's chromosomally male. Does that mean that that's her biological sex, or the fact that she has her bra side is a 36 double D naturally, without implants, without anything? Does that mean so she has none of the primary characteristics of male, but she has all of the secondary characteristics of female? Does that make her biologically female or biologically male? And the field can't agree on this. Okay, so many of us therapy types just say, hey, we're going to only bring up gender dysphoria and gender identity disorder when it is a crisis. And in this case, the psychiatrist has the crisis that he inflicted on this patient. She doesn't have the crisis at all. And so my assessment report ended up backing up Ginger, which was quite lovely. So she was able to keep her job. She's now a practicing psychologist, clinical psychologist in Topeka. Gosh, I miss her. She's a wonderful colleague. I wish she was close enough I could refer clients to her. Regardless, so Matt, what does this have to do with sex and gender? Everything, okay? Guys, it gets even more complicated. Just on the sex side, let alone gender. Now let's bring in sexuality, right? Those we prefer to share our jiggly bits with. Right? Do we prefer to share our jiggly bits with people who are biologically similar to us chromosomally in terms of primary and secondary sexual attributes? Or do we prefer to do that with people with different jiggly bits and different primary and secondary sexual attributes? I just realized I didn't find, thank you, Leilani, I realized I didn't define primary and secondary sexual attributes. I appreciate you reminding me. Primary sexual attributes are genitals. Pretty much is the way it boils down. Yes, for those of you that have taken an anatomy class, it's a little more sophisticated than that, but for this class, we're going to keep it simple. Primary sexual attributes for male-bodied people are testicles and penises, okay? That is primary sexual attributes. For XX-bodied people, usually it is clitorises and vaginas, right? Labia, etc. So genitals. Secondary sexual attributes for males are deeper voice, hairier bodies, greater muscle density, right? For female-bodied people, it is breasts, narrow waist, broader hips. Poop. There's a lovely video. I wish it's actually just an animated GIF where a teacher is trying to demonstrate the pelvic structure changes between male-bodied people and female-bodied people on average. And so he takes a plastic baby doll and he throws it through the female pelvis, and she winces and looks down, because, two skeletons and the skeleton winces and looks down, but the baby's, sails right through. And then he picks the baby up off the floor and does it to the male skeleton, and it jams right there in the pelvis, and the male skeleton freaks out and starts running around trying to get the baby out of him. Okay, so secondary attributes, again, broader waist and pelvis, narrower waist, broader hips, breasts, etc., proportionally less hairy, proportionally less muscle density. And so those are primary versus secondary sexual attributes. But here's the problem. Again, I had to keep using the word average, because when we take male secondary attributes, sexual attributes, and female secondary sexual attributes, they overlap. Like, we have women who identify as women, they're XX bodied, but they have pretty thorough muscle density, or they're a little hairier, or they're a little taller, or their hips aren't quite as wide, right? Whereas we have some XY bodied people who have less muscle density or a little less hairy and who have broader pelvises, that there's actually a pretty significant overlap in the middle. And so then in terms of sexuality, it gets even more complicated. Let's go back to androgen insensitivity syndrome. That we find with androgen insensitivity syndrome, or AIS, that the manifestation follows like a normal curve. We have people like Eden Atwood, who is very, very insensitive to androgen, so very much developed into a female body, even though she has XY chromosomes, okay? The client that I consulted with back in Indiana, this young couple, right, that she's way on the tail end. She very much developed with very obvious and very manifest secondary sexual attributes, right? And so, but when we go towards the middle, then we find that there is fewer and fewer feminine secondary sexual characteristics to even ambiguous genitals, and then to more and more masculine appearance, right? Secondary sexual attributes. So here is where people seem to be intersexed, in the sense that their testicles don't necessarily descend, their penises are usually quite small here in the middle. And then as we go further on the tail, then we have people who are, still soft skin, they're usually very slender, they don't grow facial hair very well, their voices are usually a little higher pitched. But regardless of where you are on the AIS spectrum, you're 85% more likely than somebody without AIS to be an androsexual. And so you say, okay, Matt, this is why I take the class. What's an androsexual? Well, I'm a little nervous about taking things up as static identity. An androsexual, though, are people who tend to find masculinity attractive. Okay, you have homosexual and you have androsexual, and they're related and different. All androsexuals, I can't say all. Good point. Thank you, Leilani. That many androsexuals are homosexuals, but not all homosexuals are androsexuals, because there are people who are androsexuals, but they're sexually attracted to masculine women. They're rare, but they're out there. Okay, so the ones who just really find like beefy female weightlifters very, very hot, right? They're out there. And actually, you don't have to be an androsexual to find weightlifters hot, but they have a particular archetype that they're nearly exclusively attracted to. And so a friend of mine who's an androsexual, he calls himself a lumberjackosexual. And just, as a way to joke around. He finds big, hairy, burly, sweaty, calloused hands, manly men who can fix cars and chop down trees. He just, that gets his motor running, right? And so we find that androsexuals often have AIS, or actually the better way to phrase it, you're right, is the other way around. People with AIS often are androsexuals. Okay, some of them are homosexuals, but only about 15% of them identify as heterosexual, and they have to be on this end of the spectrum, right, where they have more male bodies. If I'm on this end of the spectrum, then if I have a female body but XY chromosomes and I'm attracted to men, then that's considered straight because I believe myself to be a woman, right? So we have these discussions in this class so we can begin to shake people's assumptions that there's such thing as male and female, gay and straight, and we can just throw it in the air and say it's not ever that simple. So Saturday, yeah, just a couple days ago. So Saturday, depending on when you're watching this, a couple of days ago, maybe weeks ago or months ago, depending on when you're watching this. But Saturday, I was stopping by to get some tea at a little Peace on Earth coffee shop in downtown Provo. And one of my former students, they come up to me, and I'm like, Lexi, and Lexi gives my wife and I a big hug, and it's very good to see them. And they go, okay, just so you know, I'm going through the transition. I identify as agendered now, or as gender non-binary. No, they very much said gender non-binary, which is different than agendered. And so therefore my pronouns have switched from she to they. And went, cool, gave her a big hug. And we chatted about grad school. They're in graduate school now in a counseling and psychotherapy program, et cetera. And then they wandered off to be with their friends. And after one more wave, we headed out. Now, there is no pause and no hiccup for my wife and I, because who they embody and how they embody sex is variant from the norm, and how they embody gender is different from the norm. And therefore they are trying to find a way to be an engendered person and have a gender to perform in this navigated space of being that we all share authentically, both to the space that we share as well as to themselves. And it can be really tricky to do. And so I would challenge those of you who are listening to this to be the ones that you will always be there and appreciating and accommodating to other people's performances of gender, right? And so some people get really upset and uptight. They're going, but where are the boundaries? Where are the rules? We have male bathrooms and female bathrooms. And I go, yes, we do. And they go, so what happens if a person with XY bodies wants to go into a bathroom for XX people? Okay, that gets really complicated, because first of all, not everybody in those bathrooms was XX to begin with. We'll get to that in a second. And otherwise, if they are identifying as female, then the last thing they're going to want to do is to participate in any activities that the other XX bodied people have going on in there, right? That they're there to pee and to urinate and to wash their hands and to check their makeup, and if they wear makeup, and that's it, right? And so some of you may remember that, oh, it's been about 10 years ago, but some states started to open up gender inclusive bathrooms, kind of modeling after some countries in Western Europe. And there was this, oh my gosh, men are going to be faking trans dynamics in order to get in and see women pee. And there was this big freak out. And lo and behold, nothing happened, right? That's not necessarily what bathrooms for. Yes, there are occasional blips where somebody has a defecation urination fetish, and those make the news. But how many of those have been in light of somebody faking a trans dynamic, right? It just doesn't happen, or a gender non-binary dynamic. The other thing I get to chuckle at is, did you notice it was always one way? It wasn't guys up in arms of going, what if an XX bodied person comes into our XY territorial bathroom space and wants to see us pee? Like, nobody ever mentioned that. And so now I grant that that's because women are disproportionately victims of violent sex crimes. So therefore tends to be understandable more anxiety around male intrusion into female spaces. Totally get that. At the same time, though, I just chuckle at the irony that nobody cares if male spaces are intruded upon, because males don't care. So I could go on and on and on about androgen insensitivity syndrome. Like, later on, we're going to talk about sexual attraction, but just to plant that seed, like, I was taught growing up that gay people choose to be gay, right? Now, all of you know that's just ludicrous, but that's still being taught. And so it dawned on me, I was about 12 after I heard that. I was reflecting, going, wait, when did I choose to be attracted to girls? And for the life of me, to this day, I can't remember ever making that choice, right? I don't remember waking up and saying, dudes, girls, dudes and chicks, male, female, which way am I going to go? There was no choice for me. I've always been very, very interested in XX bodied people, disproportionately so, vastly disproportionately so. There was no choice there, right? It's just always been. And so therefore, was there a choice? So I started asking my friends in junior high and high school, those I suspected were gay and then came out during high school and college. I said, when was your choice point? And they look at me and they did the same thing. I don't remember ever choosing this. You know what I mean? Now, granted, we have some say in what we do with our sexual attractions, but we don't seem to have a say in who we're sexually attracted to. More on that later. So I wanted to show you this little, it used to be a graph, and then Canvas worked its magic. So now it's just a spew of letters. So we have these following genotypes: XXY, XXYY, XXXY. They're often gendered male, and the condition is, the phenomenon is called Klinefelter syndrome. So this is a non-viable sex. They're sterile, they usually have small testicles, a condition called gynecomastia. Gynecomastia is breast tissue development in men. Okay, so you don't have to suffer from Klinefelter syndrome. You don't have to experience Klinefelter syndrome to have breasts as a male, right? In fact, I don't know if we'll get into this in this class, but androgen is actually metabolized into estrogen. So, sorry, testosterone in particular. So and it's metabolized by adipose tissue, by fat tissue. So fat guys tend to turn their testosterone into estrogen, which is why some obese men grow breasts, okay? So XXYY, these folks are identified as male and often identify as male. The syndrome is XYY syndrome, although very, very few of them know that they have this particular syndrome. In fact, many of them can go their entire lives without knowing unless they take a particular blood test to detect it. So they have normal male traits. Now, I say normal male traits with a little bit of a grain of sand, though, a little bit of a grain of salt, because people with XYY chromosomes are disproportionately found in correctional facilities around issues around drug and violent crimes. So they're like 50 to 60% more likely to be found in prisons. Now, keep in mind, they're super rare in prisons. This is not a common syndrome, but they're far more likely to be found in prison than they are in the general population. And so that has led some researchers to call those with XYY syndrome the hypermasculine syndrome, meaning they're more aggressive, more hairy, more muscular, et cetera. And there doesn't seem to be a whole lot of evidence in terms of their bodies being different, like hairier or more muscular, but there is a little bit of evidence that they're a little more aggressive. So XO is Turner syndrome. And with Turner syndrome, the sex organs don't mature. So they're usually identified as female, and they're usually raised as girls, and they usually identify as girls. So their sex organs are there, but they don't mature, therefore they're sterile. They're usually short in stature. And in fact, while I've got you here, I will show you a couple images. So here are some examples of Turner syndrome. You notice the way these kids are built, like their necks are really thick, their shoulders are high up. Maybe you can't see that, so let's bring up this particular image. So that's an example of Turner syndrome. You notice the thickness of the neck relative to the shoulders. Okay. So another example there. And there is often associated with heart troubles. Heart-shaped face, low posterior hairline, broad chest, streak ovaries. Okay. So their limbs are also a little bit differently proportioned. And I know some people with Turner syndrome, and they're bright and capable and confident. One of them I know is a mom. She adopted her kids. But now we know enough about Turner syndrome that we don't lose as many of them to heart problems. So there are things that can be done earlier in these kids' lives to extend their life expectancy significantly. So, and they're also very short. So then there's XXX. They're often identified as female, very often identified as female. The syndrome is called trisomy X. they're tall in stature. They usually have some learning disabilities. There's limited fertility, but at the same time, some of them can and do reproduce. And so they're often intellectually disabled, but not necessarily. I know one woman with trisomy X who is very, very sharp. She hasn't given me permission to share who she is. Some of you may actually know her. So she does have computational learning disability. Math is her struggle, right? She had to take college algebra 3 times to get a D, but she's top of her class. She was top of her class in English, for example. So, and she has had a baby. They struggled for years, she and her wife, but she and her husband actually, but they did have one child. So right now we have how many viable sexes? So we have XX, XY, XYY, and XXX. We have 4 viable sexes. So next time somebody tells you, hey, we only have 2 sexes, say, no, we have 4 sexes that are viable, and we have more sexes than that. But if you want to count just the sexes that can reproduce, we have 4. So there's also what's called alpha reductase deficiency. Genetically, male children appear female until puberty, when the clitoris grows into a penis and the testes descend. So it's really neat. Some of you may look this up if you're curious. The condition is fairly common in a village in the Dominican Republic, and they call these kids huevadoches, or eggs at 12. When the testes descend, these teens go on to identify as a man. And what's really interesting about these children called huevadoches is that there's very little psychological disruption for them. Like, if the same thing happened in our culture, there would be stress and strain and drama and divorce and suicide attempts and everything else. In their culture, there's not. It's just taken up as, hey, here you go. This is something that happens. And because it's normative in their society, nobody bats an eye. Therefore, there's very little stress and drama about it. So, as a tease, if God created man and woman, Adam and Eve, why are there so many genetic abnormalities? Are these people male or female? Likewise, if this is all evolution, how could these traits be evolutionarily advantageous enough to keep happening? Now, some of you who are religious caught this religious problems with my first claim, and those of you who actually know something about evolution caught problems with the second claim. Right? Those of you who have studied religion well understand that variance in mortality is built into the experience, right? That variance is well and broadly assumed, right? In terms of sexes and genders and everything else. Now, some people get a lot of heartburn because there are some denominations that privilege and emphasize sexual dimorphism, right? They're heterosexist. You have male and female, doctrinally, ontologically, etc. And others then that also very much say that that eternal progression is dependent upon knowing, identifying, and doing something about a heterosexual relationship while you're still alive, what some denominations call immortality. So like, if you have one of these other 2 sexes, XYY and XXX, how does that function in terms of eternal marriage, etc.? If you have androgen insensitivity syndrome and you are incapable of performing sexually with a woman and you're only sexually attracted to manly men, what do you do about that, right? So there's a lot of problems only when religions very much hyper-privilege the gender binary or heterosexist dynamics. And so many religions that I'm aware of struggle with this and how to remain inclusive while still holding on to their doctrine. And the struggle is real. And so likewise with evolution, one of the things that we get to point out is there is a tendency in psychology to make all traits functional traits, okay? Meaning that any genetic variation has a function in terms of survival of the fittest for a given organism. So therefore, XXYY, right? Klinefelter syndrome, trisomy X, right? XYY syndrome, Turner syndrome, that those must have some advantage evolutionarily speaking. Unfortunately, the worst evolutionary thinkers are psychologists, right? Because biologists keep pointing out that a lot of things don't have evolutionary advantage, that how evolution works is that evolutionarily advantage and this evolutionarily disadvantageous phenomenon are determined in environment, right? So therefore, it's not just adaptive in the way psychologists often talk about it, that biological evolution is very different than the way psychologists talk about evolution. Like he's actually an evolutionary biologist by the name of Richard Dawkins, who's a fierce critic of religion. And I chuckle because when I bring Dawkins' work to other evolutionary biologists, they throw up their hands and say, he's a terrible scientist, right? He's a very colorful and charismatic critic of religion, but he's a terrible scientist. And so we talk more in the psychology of good and evil about those who have deconstructed Dawkins' work and his responses to them. So one of the things that, let's see, did we talk about it in this lecture? We may not. Okay, so I'm going to talk about it now. One of the things that I would like to highlight is Jeannie Marichek and Rachel Herrmuston's research, philosophy, etc., on what they call alpha bias and beta bias. Alpha bias is our bias. All sexes and genders are inherently the same. Like men and women are just the same, right? You can't distinguish them. They're all the same, right? That if given free choice in a free world, that women would choose to be engineers at the same rate as men, that they would be interested in child rearing and child raising as much as men, they would have the same taste in clothes and coffee, etc., as men, that's alpha bias. And they problematize that a lot, and they highlight how it is that that's just not the case. So we'll talk about this later in the semester, but there were, in fact, I think they still played tennis, but Venus and Serena Williams once bragged that they could take on any man in tennis. And so the 72nd ranked man in tennis, and Serena and Venus were number one. And this particular man, 72nd, spent the morning in the bar, got a little tipsy, came out, challenged them to tennis matches, and just stomped them. He beat most sets most of the time by a large margin. And so Serena and Venus had some interesting reactions to that. But those who understand the way male bodies work, it's not surprising. Like, we'll talk about this later, but later in the term, we're going to give a little presentation on the men's deadlift world record and the women's deadlift world record. And the people who hold the alpha bias will then try to make claims that the reason why the women's deadlift record is a third of the men's deadlift record is because of some kind of discrimination. When the biologists go, it's not discrimination. Women's bodies and down to the cellular level are a little different to a degree, and it accounts for that particular difference, right? The land speed records in terms of running, there's a pretty big difference there, right? And if you're a track person and understand that microseconds count. So likewise, there's this other side called beta bias, which is, then men and women must be totally different, right? That men are from Mars, women are from Venus. I don't even understand women. They're such a mystery, right? I don't understand men. They're just a mystery, right? That there's this whole other side that says that men and women are totally different. Well, that falls apart under scrutiny as well, because men and women are remarkably similar. Like Leilani and I gave the lesson, last week, right? About all the things that we have in common. Like I can see a small image of her. She has 2 eyes. Just like I do. Oh my gosh, she has 2 ears, and she has a mouth and a nose and hair and stuff, right? A neck and shoulders. Besides that, I have no idea. But she has at least those things in common. And so likewise, down to the cellular level, we're more similar than we are different. And so one of the things that Jeannie Marichek and Rachel Herrmuston point out is that if we take alpha bias, that we're all the same, that actually does violence to our understandings of sex and gender. And if we take up beta bias, and say we're totally different, that also does violence to our understandings of sex and gender. They said what we need is a model where men and women are both similar and different in many ways at the same time, and in fact are more similar than different, but the differences matter in the face of the similarities. And so if you're curious about Jeannie Marichek and Rachel Hare-Mustin's work, I would encourage you to look it up. They are, Jeannie Marichek in particular is one of my favorite scholars. Lovely human being. Okay, so let's see, I have 2.5 minutes to make some pretty big claims. So how about I make some pretty big claims, as if I haven't already, and then leave you with a bit of a cliffhanger. So, as you know, we don't go to all the same doctors all the time, right? We talked about that last time. Women have bits and men don't, and vice versa, right? Men have testicles, women have ovaries. Men have penises, women have clitorises. The male gametes, the male reproductive cells, men create millions upon millions of them compared to a single egg, right? For a woman to create an egg is a much larger biological investment than for a man to create a given sperm cell. So our biological differences are also neurological and behavioral. Women on average are not as strong as men. Now, again, there are some women who are stronger than some men, but on average, women are not as strong as men. Men on average are not as socially perceptive as women. And to be biological, regardless of how people are raised, women are on average more attuned to social feeling and social dynamic than men are. Again, on average. My wife and I, for example, are the exceptions to that average. I'm usually pretty well attuned to the feel of a room and what's vibing between people, and she's more object focused than I am. But we're also not average in those ways. We're a little weird. So men and women process and experience emotions differently. There was a long time that we thought that stoicism was because men are acculturated to be stoic, meaning not to show many emotions. And that is partly true. At the same time, though, men also manifest feelings a little bit differently. For example, a man might be suffering like something like depression, but it's more likely to come across as irritability than weepiness, because of the way men are wired and not just the way they're acculturated. So sexual experience behavior is a little different. And so we'll give more examples of that as we go through the semester. So I'm actually going to pick up here on the sexes are different, and then we're going to talk about some similarities as well, because I only have 7 minutes left. So thank you very much for joining us today, and I look forward to hearing your questions by email or on Canvas. Leilani, are you going to be sticking around for a little bit? Okay, cool. Okay, bye-bye, everybody. Thank you very much for your help.